Welcome to BanishCancer channel. Today, we're exploring one of the most important skills in healthcare, how professionals can balance hope and reality in conversations with patients. When someone is facing cancer, words carry enormous weight. Patients need honesty, but they also need compassion. They need to understand the facts, but they also need to feel supported and hopeful. Striking that balance is not easy, yet it's essential for trust, informed decisions, and emotional strength. Healthcare professionals prepare carefully before these conversations. They review the patient's chart, choose a quiet and private space, and even rehearse how to deliver difficult news. This preparation ensures the focus stays on the patient, not on interruptions or rushed words. So what does balancing hope and reality really mean? Hope is the patient's desire for something good in the future. It's not guaranteed, but it gives meaning and motivation. Hope helps patients cope with stress, find strength in family and friends, and focus on what matters most. Reality is the clear understanding of facts, what treatments can and cannot do, the risks and benefits of each option, and what science can realistically offer. Together, hope and reality help patients make informed choices while still feeling cared for. Active listening is another cornerstone. When professionals truly listen without interrupting, they hear patient fears, values, and goals. That allows them to respond with empathy and tailor information to what matters most. Simple, clear language is key. Medical jargon can overwhelm. Instead, professionals use plain words, visual aids, and check for understanding by asking patients to repeat back what they've heard. Nonverbal cues also play a huge role. A gentle tone, open body language, and eye contact show respect and compassion. Even small gestures, leaning forward, nodding, or pausing to let silence settle, can make patients feel safe and understood. And then there's informed hope. This means offering optimism without exaggeration. For example, a clinician might say, "This treatment can help manage your symptoms and we'll be here to support you every step of the way." It's honest, but it still gives strength. Training and reflective practice help professionals improve these skills. Role-playing with simulated patients, learning active listening, and reflecting on past conversations all build confidence and compassion. Communication is not a fixed talent, it's a skill that can be learned, practiced, and improved. Of course, there are pitfalls to avoid. Being too blunt can shock and alienate patients. Offering false reassurance can break trust. Ignoring emotions can leave patients feeling unseen. The best communicators balance facts with empathy, ensuring patients feel respected, supported, and empowered. Practical strategies make a difference. Professionals prepare emotionally before entering the room. They silence phones, ensure privacy, and give patients unhurried time. They ask open questions like, "What worries you most right now?" They acknowledge emotions with phrases such as, "I hear your concerns." These small steps create a safe space for difficult truths. In end-of-life conversations, clinicians use structured approaches to guide discussions. They talk about comfort care, spiritual needs, and what matters most to the patient. Even when the news is hard, patients can still find hope in small goals, time with family, moments of peace, or spiritual strength. Spiritual hope is another dimension. Many patients draw strength from faith or personal beliefs. Professionals respect this by asking gentle questions like, "Is faith important to you?" or "Would you like spiritual support?" They never impose their own views, but they connect patients with chaplains or advisors if requested. This honors dignity and helps patients find meaning. Balancing hope and reality is about dignity. It's about giving patients the truth they deserve while also giving them the strength to face it. When healthcare professionals master this balance, patients feel informed, supported, and never alone. Thank you for joining me on the BanishCancer channel.